Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Amoxapine. Its brand name is Asendin. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Amoxapine is an antidepressant with mild sedative properties and an unknown mechanism of action. It reduces the uptake of norepinephrine and serotonin and inhibits the response of dopamine receptors to dopamine. It is not an inhibitor of monoamine oxidase. In terms of indications for use, Amoxapine is indicated in the treatment of depression, as well as in the treatment of endogenous depression. It can also be used in severe major depression with psychotic features. Now, before somebody was to use Amoxapine, there are some contraindications they must clear, as well as some precautions and warnings they should be made aware of. This medication is contraindicated in patients who are in that acute recovery phase following a myocardial infarction. It's also contraindicated in patients who have used a monoamine oxidase inhibitor in the previous 14 days. And finally, it would be contraindicated in patients who have a hypersensitivity to dibenzoxazepine compounds. Now, in terms of precautions, this medication is on the Beers criteria, which is a list of medications that the elderly population should avoid or use cautiously. In this population, we would be concerned of the anticholinergic side effects and the sedation that this medication can cause, which again in this population could result in falls, therefore fractures. This medication should be used cautiously in patients who have cardiovascular disease. This is because cardiac conduction defects, arrhythmias, or tachycardia may occur when this medication is given in high doses. It's important that patients are made aware that heart attacks or myocardial infarctions, as well as strokes, have occurred in patients using Amoxapine. Allergic reactions that manifest as skin reactions or a drug fever have been reported and can become serious in certain situations. Discontinuation of the medication would be appropriate if this is suspected. Potentially fatal neuroleptic malignant syndrome has been reported with the use of this medication. Potentially irreversible tardive dyskinesias may occur. This would be more likely to occur in the elderly population. It should be used with extreme caution in patients who have a history of convulsive disorders. Patients should be made aware that extrapyramidal side effects may occur with the use of Amoxapine. Patients who use Amoxapine who have bipolar disorder may put themselves at an increased risk of becoming manic. Exacerbation of psychosis or paranoia may occur in patients who have schizophrenia. And finally, it should be used cautiously in patients who have a history of urinary retention. Now, once a patient is cleared of the contraindications and made aware of the precautions and warnings, and they start using Amoxapine, they can expect to take it in tablet form. Typically, an initial dose of 50 milligrams 2 or 3 times daily will be used. This dose can then be increased to 100 milligrams, again 2 or 3 times daily, within the first week or so. Some physicians may choose to start their patients on a higher dose, such as 300 milligrams daily, again in divided doses. For the patients that start on that higher dose, they can expect more sedation for the first couple days of therapy. The usual maintenance dose is anywhere between 200 and 300 milligrams daily, again broken up in doses throughout the day. If a patient is using 300 milligrams for about 3 weeks and doesn't experience much relief of their depression, then they can try 400 milligrams daily. The highest dose that would be used would be in hospitalized patients who do not have a history of convulsive disorders. They would receive up to 600 milligrams daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Amoxapine, so I'll list some of those here for you now. Constipation can happen in 12% of patients, and xerostoma can happen in 14%. 14% of patients experience somnolence, 7% experience blurred vision, and 14% may experience fatigue. Now, some more serious side effects would be heart block, myocardial infarction, agranulocytosis, prolonged QT interval, and then finally the development of suicidal thoughts or ideation. That's all we're going to talk about today for Amoxapine or Asendin. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.